Okay, so you're
this year.
8 months, 9
Yeah.
months, about that.
Yeah.
Huh? How much weight have you lost?
62 pounds.
Wow. Hey, you look great.
I feel great.
Good. Good. And the surgery was outpatient surgery?
Yes, sir.
Good. And how was that?
It was great. I was your first patient for the one whole procedure.
Yeah, the single incision. Right. And that was there's a lot of people asking about that. Would you do that again, or what would you do? I mean, just tell me what you think.
Yes, sir. It was great.
You liked it?
I had it done on Thursday and was back to work on Tuesday, but I could have been back to work on Monday. But
Do you think the single incision is worth it? Because I'm not sure myself. I'd like to know what you think. Really?
I think it is. I didn't have much pain. I mean, it wasn't. It was just real easy just to get back into life, you know.
Right, right. You're
great,
happy with
wonderful. Yeah. So things that I thought I couldn't eat for the rest of my life is I can eat anything.
Well, that's an important point. A lot of people don't really understand that. So you don't have to limit your diet per se.
No, I eat anything. But now, since I've had the lap band, when I eat sweets, it's kind of turned off my sweet tooth. I don't feel really good when I eat something sweet, and so I don't want that, you know.
Yeah. So it helps you control that.
Yes,
That's really good.
I didn't. Yeah, I hear people say it doesn't help them, but I'm like, help me.
Yeah, there is a lot of variation from patient to patient, and that's why I think it's important for patients to hear other patients talk. What about activity? What can you do that you couldn't do before? Anything?
Reading storybooks to my girls. I don't get out of breath. Playing with them. We play and run, and they like to be my trainers, doing exercise. Okay, Mama, do your jumping jacks, do your sit-ups, whatever, But
so you've got an exercise routine going.
We exercise together.
Well, that's good. That's very good.
So I'm teaching them to exercise. So we're
What kind of work you do?
I'm a dental hygienist.
Yeah. And has it changed anything at work? Does it help you at work much, do you think?
I think so. I mean, I could, like right after lunch, after I'd eat something, then I'd be cleaning my first patient after lunch. I'd be breathing heavy, So now it's like I'm not breathing heavy over my patient.
Can you sense how people interact with you? Or
I do.
I mean, that's one of the things that we don't like to talk about. People really don't like to talk about this, but I was wondering, since you're in the medical kind of field, do you think people regard you differently, having lost weight?
I've had a patient come in before, an older gentleman. He says, you just keep getting bigger and bigger and bigger. This is for, he's not around anymore. But, I think people are more friendly and outgoing with you when you are smaller than when you're bigger.
It's a shame, but I think that's true.
It is true. It is true.
So that's an important part of what you're doing, because you're dealing with the public every day.
Right. Yeah. I even mentioned to my husband, I said, I'll probably get a lot more patients now that I'm slimmer. He said, you think so? I said, yeah, probably so.
I hate to admit it, but I think it's true. And I think most people don't like to talk about it, but it is an important part. I mean, big folks are discriminated against.
Yeah, even if you do a real good job cleaning teeth, if you look good, then I want her to clean my teeth.
That's right. Okay.
Great.
What about how about the fills? How often do you get your fills?
I get them every 3 to 4 weeks, and doing great with that. I just got a fill last week, and everybody said, "You want to get filled right before Thanksgiving?" Yes.
Yeah. Now you get over to the Bariatric Center, you get your fills, and Amy or Michelle or just
Michelle last time, but Amy does it too. They're all friendly and just girls.
How is it to get how long does it take for you to get a fill?
Oh, maybe you're in and out about 15 minutes.
Before it's up here in the shoulder?
Mine's down here.
Oh yeah, that's right. I forgot that.
I like it down here.
And it's easy to get to?
Yes.
Yeah, good. All right.
They just have to lay me down to do that instead of sitting up. But it's fine. And it doesn't hurt to get the fill. They don't ever hurt me. So.
Pretty easy to do.
They're real easy.
Okay. All right, well, congratulations.
Thank you. If I had to do it again, I would say I'll do it right now.
Thanks.
Like, don't take my lap band away.
Yeah, that's right. Take my arm, my leg.
Yeah, don't take my lap band.